afternoon, everybody. Thanks for bearing with us. We had some technical difficulties getting started, but now we are ready to roll with the CANS webinar for February. This one will be a new user check-in. We'll also go over some frequently asked questions. I sent an email out last week asking if anyone had questions to submit ahead of time. I did get a few responses, so I've made sure to incorporate those into this webinar, and then we'll also have an opportunity at the end for any additional questions or clarification that anybody needs. Okay, so the first area, and if you are not a new user, you can by all means participate. Some of this is going to be a refresher for you. So the first area that we're going to cover relates to scoring and applicability. So a common question we get is whether it's true if a foster parent is doing something, and you could relate this to any out-of-home care placement. If they're doing something that leads to the extinguishing of a higher level behavior, that you count that child as having a higher score due to the necessary behavior on the part of the foster parent. So this is where CANS key principle number 3, which talks about rating the child versus the child in services, comes in. And it states that if an intervention is in place that is masking the need but is necessary to address the need of the child, this should be factored into the rating. So you consider whether or not it is a sustained change on the part of the child, and if it is a sustained change, it would be rated lower for the child. If it is a change only because of the intervention, and if the intervention was removed, the behavior then would return, then the item would be rated higher. And we'll talk about this again a little later with some context and examples as well. Another question, again, it's about rating the child versus the child in services. This is the same thing. So an example of this that we often use relates to a child who has a medical need, and that medication is managing whatever the issue might be, or other treatments are managing it. The symptoms or the medical issue returns if the treatment is removed. So if you stop medication, you would see the behavior come back. So a classic example would be a child with ADD on medication. They do fairly well. They aren't as impulsive and risk-taking and things like that. On medicine, if you take it away, they immediately would become more risk-taking and less attention, maintaining their attention and stuff like that. Another question we get relates to whether or not birth parents are ever chosen as the considered identified permanent resource. Wouldn't a birth parent be a primary if reunification to the birth parent is the primary goal of the permanency plan? So there's some guidance in the EWIS-ACWIS Quick Reference Guide on choosing who you choose, but in essence, the parent could be. So an IPR is how it's referred to at times, so the Identified Permanent Resource, depends on whether or not the permanency goal is reunification. So if the child's in placement, the out-of-home care placement provider would be the current caregiver, and if you're expecting to reunify the child with their parent, then you can choose the parent as an Identified Permanent Resource for scoring purposes. And again, there's more in the Quick Reference Guide about that. But if the child is at home and you're doing a CANS, then the caregiver would be rated for the parent if they were living at home. If there are two different parents in two different households, and both of them are listed as Identified Permanent Resources, and both are moving towards reunification, so the question is, do you score them together? Do you score them separately? How do you do that? So the answer is, if they're living together, you would score them together as one Identified Permanent Resource. If they're, as the question states, living in two different households, and the potential for reunification is with either of the parents, and you then would rate both of the parents as IPRs as their own Identified Permanent Resources. So if they're together, you rate that family, the parent unit together, And if they're separated, living in separate households, and you're potentially reunifying either with mom or with dad, or if the child has two moms, however that might be for the child situation, you would rate those households as their own entities. And again, there's more information in the quick reference guide that is available attached to this. So how should actionable items be documented? There's a couple of different ways that you can document what you're doing about the actionable items. So the results are reported in order of their level of action on the CANS results page. For example, if a child was suicidal, you would need to build an action plan around the child's suicidality. This can be recorded on the actionable items tab in the narrative boxes or in the child's permanency plan. You would see that this child would need to be seen and assessed immediately, and you could also include information such as locking up medication, sharp objects, and supervision requirements. You would take history into account in these plans as well. You would also include this information in any other plans that you have for the child. So you're required to document it in the child's permanency plan. You may also document it, what you're doing about it, in the actionable item section of the CANS results page. Scoring and applicability related to a child with a level of need of 4 being placed in a home that is level 3. So this is primarily for foster care. So a child with a level of need of 4 or higher can be placed in a home that is level 3 or lower. And let's look at the placement complexity chart. So if you do that, so if the child's level of need is greater than the provider's level of care certification, you do have to document an exception for the child with that provider. And you document that on the child's CANS results page. So you'll see the red box here shows there's like a, if you need to document that when you get to the results tab of the child's CANS, this will be blue, meaning you have to document something there. If it's not required because the child's level of need is either equivalent to or less than the provider's level of care certification, then you'll see this grayed out and you won't have to document anything here. What you're going to document here is what supports and services you're putting in place to support the caregiver in addressing the needs of the child that is placed with them, which could be something from training, it could be respite, it could be additional services put into the home, it could be a variety of things of what you're going to do to support that caregiver with that child. And again, we're going to go into a little bit more into this in a few minutes. When scoring the current caregiver or identified permanent resource, are those items rated in relation to the child, or are they rated in general for that provider? The CANS in general is scored for a specific child, so any items that you rate are in relation to that specific child. So a current caregiver who maybe has more than one kid placed in them, or an identified permanent resource that is being considered for more than one children, could have different ratings depending on the child that you're rating the provider for. So it is a child-specific rating for that provider. Generally, they don't change too much from provider to provider, but they may. How should abuse or trauma be rated when there is no confirmation it occurred? What about a youth who gets into physical altercations with their birth parents? Is this physical abuse? Okay, so if there's a suspicion of abuse but no confirming evidence, such as the kid has not disclosed it, there's no physical evidence that anything occurred, then it would be a 1 because someone maybe thinks it might have happened, or maybe thinks that, maybe it was in the history but it's not clear. That's watchful waiting. That means there's something you're going to keep an eye on because people have maybe a suspicion that it happened, and you're going to put preventative measures in place to ensure that things do not get worse in this area. And just to sort of keep everyone's, eyes on the situation in terms of if there's other triggers or disclosures, that people can take that into account at any adjustments periods when you come to review the plan of care for the child. For the physical altercation, you would rate that under family nuclear. It would not be rated under physical abuse unless there was abuse aspects to that physical altercation with the parent. But if we're just talking like a teenager and their parent pushing each other and it's not physical abuse, that's where you would go with it. You should note that it wouldn't be put under witness to family violence. If the youth is actually involved in the violent activity, then they are not a witness to it. A witness refers to the instances that the youth is observing but not participating in the action. Can you define family nuclear and family extended, especially for post-TPR cases? So family nuclear refers exclusively to the youth's parents and siblings. However, the definition of family should come from the youth's perspective, i.e. who they describe as family. So if they've lived with their grandma for their whole lives and never their parents, then that would be their nuclear family. In most TPR cases, the family nuclear would refer to the adoptive resource for that child. Family extended refers to all other family members, excluding parents and siblings. Again, the definition of family should come from the youth's perspective. In post-TPR cases, this would include the child's biological family members, such as their birth parents and siblings, and the extended family members of the child's adoptive resource. If a child is being bullied, they are the victim and it is causing stress in their life in many domains. Where should this be rated? Under exploited, under social functioning peer. It could actually be rated under both. If the youth is being bullied, it would be rated under exploited. If as a result of the bullying they are experiencing problems with peers, then that would be social functioning with peers and it would be also rated there. It would only be rated under exploited if it was a single bullying incident and the child is managing to not let it affect other peer relations. This is also an example of how it can be appropriate to rate an item in more than one area at a time.
All right, we are going to go ahead and move on to some commonly asked EWIS/SACWIS questions that are related to the CAN. The first question is, it appears that only the person with a primary assignment to the case can complete the CAN. Is this accurate? And then it'd be helpful if foster care staff could complete information in the current caregiver section, or supervisors could help complete information if the worker is unexpectedly out of the office without having to change assignments. So anyone with an assignment can work on a CAN, not just the primary worker. More than one worker cannot work on the CANs at the same time. That is something to keep in mind. When this happens, data could be lost if answers differ and both workers try to hit save. Workers without the security to complete a CAN should have their security delegate send an e-pass request to request the security to go ahead and do that.
So I just want to mention that, the comment about foster care staff completing the current caregiver section, that would be inappropriate because you're relating that scoring to that specific child. And if this question was in reference to licensing staff, they may or may not have information as to how that specific child is doing with that particular foster parent. And that's the information that a caseworker should be gathering when they're out there doing monthly face-to-face contacts.
All right, what information from the CANs will pre-fill into different documents in EWIS/SACWIS? So the CANs does pre-fill into a few different documents. The supplemental portion of the CANs will pre-fill into the foster care rate page. Again, SACWIS will calculate this rate automatically for you, so you don't have to do that math on your own. When a CANs has been completed, the CANs results are used in confirming safe environments to identify any placement danger threats. For example, if a caregiver is rated with an actionable item of a 3 with regard to a specific child, then this would be considered a placement danger threat. And in these situations, the caseworker should pursue a new placement for the child, as well as ensure the safety of other children in the home. In addition, the CANs information such as the level of care, and the level of care and level of need match between the child and the provider will also pre-fill to the first tab on the Confirming Safe Environments page. When you're completing a CSE at the time of placement, if you do not have a CANS completed yet, this is okay, and the CSE will just be blank in that area. The CANS results also feed into permanency plans, and all of the actionable items will be shown here. You can see them on your screen. Will be shown, and those that must be addressed in the permanency plan will be marked with an asterisk. You can see that on your screen there. Each CANS actionable item must be addressed in a goal in the permanency plan, and the permanency plan cannot be approved unless each actionable item is selected for its corresponding goal. An actionable item may be addressed under more than one goal. So this is also something we went into detail. I believe it was our October or November CANS webinar that we did. We went into CANS goal writing and writing measurable goals. So if you have more questions or you just need further clarification on that, I do recommend going back and viewing that webinar. All right. Looks like we already did that one.
Okay, so now we're going to talk a bit about CANS training opportunities. I'm going to go to the next. So there was a question about additional CANS trainings and technical assistance. So last January in 2014, DCF and PDS put a survey out across the state to ask for input about training needs and just technical assistance needs for CANS. So DCF and PDS have used those responses to help provide additional resources such as these webinars and other training resources and other technical assistance. We started that process in late 2014. Lindsay just mentioned the webinars that we did last fall, and we will continue to do so throughout this year. So beginning in October of last year, we began hosting monthly webinars focusing on many different topics. Those are recorded and posted on the DCF website for you to go back and view at a later date. We also have webinars scheduled, I believe, through June of this year, and those topics have been sent out. Lindsay sent those out several weeks ago. So if you have questions about that, just let us know. And later this year, we will be scheduling webinars for the remainder of the year. As I mentioned, the previous ones are archived on the DCF website. We also began providing CANS case planning trainings in December of 2014, and we are working on scheduling more of those for 2015. So another resource that's always available to you is the CANS online training, which is on the PDS website, and it can be done through PDS Online or it can be done on the PDS website. So it's not just a process to go through when you need to be certified in the CANS. It's something that you can come back to whenever you may have a question. It may be your first stop to answer some of your questions. It talks about the background of the CANS, the 6 key principles, which Janelle and Lindsay touched on earlier, integrating the CANS into your practice, such as using CANS for planning, and Wisconsin CANS policies. And Module 1 talks in great detail about those 6 key principles. And like Janelle already spoke about, rating the child versus the child in services. This is a great refresher to go back to. If you have questions about the CANS, maybe you haven't done one in a while, this is a good spot to go to. Module 2 really focuses on integrating the CANS into your practice, talking about introducing the CANS to families, building consensus, and explaining the results to the team. And you'll also learn about using results in case planning and celebrating successes with children and families. Module 3 talks about the Wisconsin CANS policy, including certification requirements, timelines, foster care rate, and the rate policy, documentation requirements, and CST-specific information. Module 4 gives you an opportunity to complete practice vignettes and be given feedback on those prior to doing a certification exam. Or like I said, if you haven't done a CANS in a while and you just kind of want to brush up on your ratings, there's lots of resources there. So moving on then to CANS timelines. One of the questions that DCF gets often is the CANS effective date should be the date of the placement, correct? That's not necessarily the case. So as you guys know, a lot of information gathering and assessment goes into completing the CANS, so the effective date of the CANS should be when the assessment was completed. So once all that information has been gathered and the assessment is complete, that's the effective date of that particular cans.
I want to mention that a lot earlier in the CAN sort of rollout, people were doing that because the rate setting wouldn't allow you to go back to the data placement. Now, as long as your CANs is timely, so within 30 days, the rate setting allows you to apply that supplemental all the way back to the data placement. So that is not a reason to not do it and put an accurate date of when you're actually doing your CANs document.
Okay. So another piece about timelines is the 30-day window. So the question that has been submitted here is, for instances where a child is going to be moving from a highly restrictive environment, like an RCC, to maybe a level 1 foster home, how do you rate those items with a 30-day window, as that would not necessarily accurately reflect the child's needs in that time period? So if you have a child who, prior to placement in an RCC, had sexually assaulted a younger sibling, they wouldn't really have the opportunity to do that in an RCC. So these are times where Dr. Lyons talked in trainings about overriding that 30-day window. So it's kind of like Janelle talked about earlier, it's rating the child versus the child in services. There's a lot of overlap between these two theories with the CANs, that in certain situations you've got to look beyond that 30-day window. The other example that he always gives in trainings is if you have a child who had a substance abuse problem and got in a car accident and was in a coma for 2 months, if you're needing to redo a CANs for that child, you're not going to rate them as 0 for substance use. And his joke is always, unless he had some really enabling nurses. Obviously, you're not going to rate that child as 0 for substance use. You're going to think about, if you weren't putting those supports and services in place, going back to the example of this child who sexually assaulted a sibling, if that child didn't have that structure and the format and everything of the RCC, what would that look like for that child? So you're overriding the 30-day window and you're rating the child, not the child in services. So moving on to when a CANS is required to be completed. So there are several timelines that need to be taken into effect with the CANS. So as Janelle just mentioned, a CANS must be done within 30 days of placement into foster care, must also be done prior to placement in a group home or RCC. It also needs to be done within 30 days of placement, a new placement, but prior to a new placement in a higher level of care if the child is not already in a group home or an RCC, and then every 6 months thereafter when the child has been placed with the same provider.
All right, we will go ahead and move on to teaming with the CANs. So what is the best practice as it relates to sharing the CANs results with foster parents? This information should be shared with foster parents and the out-of-home care providers at all levels of care certification. You can share the brochures on the level of care certification, which is on the DCF webpage. You'll see on your screen there are links to both the CANs brochure and the level of care brochure. Again, both of those are found on the DCF website. So you should share those with families before reviewing the scoring of the CANs so that the out-of-home care provider understands what the CANs is before you even sit down with those results. Printing the CANs results page, which I will show you on the next slide, will give you a user-friendly version of the CANs to share with families and with out-of-home care providers. And the most helpful of which may be the actionable items page. Again, I will show you this on the next screen, which this lists out the items that were scored at a 3, 2, and a 1. This would be really good to share at team meetings. And the last page of the template is a CANs roll-up sheet as well, so I will show you guys this on the next page. All right, so I'm going to show you guys the CANs roll-up and actionable items. I'm sure you've heard us talk about this before, and if you're a new CANs user, you might be wondering what we're talking about. So we wanted to make sure we included a slide just so you could actually see what that is. So when you go into eWithSACWIS and you print off the CANs, this will be the first page that you're going to see. It's kind of a summary of the scoring for the CANs and what those results were. Let's see, and then we start looking at what the actionable items are for the child and the youth. So they will be listed out. They're not listed on this one because this was just a blank CAN, so there was no scoring that was actually done. But you would see them, I'll go back to the previous one, you would see them listed out, what those actionable items are. And if there's any narrative written with them, that would also print out with it.
You would
whatever.
see it, 3s would be clumped together, then 2s, and then 1s.
Thanks for clarifying that. And you would see the same thing for the current caregiver as well as the identified permanent resource. Again, it would be clumped in 3s, 2s, and 1s, and you would see any narrative that was written on the action steps that were going to be taken to address whatever that actionable item was. And then the last page is the CANS roll-up. So this is actually lists out each of those CANS items, and it shows what they were each rated at. It can be really helpful just when you're looking at it to see where all the 2s and 3s are, where those have been checked. So you'll see that for the youth, it's going to include both their needs and their strengths. It has the trauma score on there as well. And then you'll see it for the current caregiver and the identified permanent resource. So this is just a really helpful, easy way to present the CANS results to the team members.
We should mention that for identified permanent resources, you can enter multiple IPRs. So if you're looking at 4 different relatives, you can actually score 4 different households in terms of what their capacity is to potentially care for the child on a long-term basis.
Thank you. All right, so the child's team be included in completion of the CANS. So before administering the CANS tool, the person who is actually doing the tool needs to do all of the following. You should make sure you review the case record. You should interview or collect information from an individual who has interviewed the child or the child themselves, the child's family, the foster parents, the other out-of-home care provider, whoever that may be, the child's team or treatment team, as well as the licensing agency. You should also review information gathered in collaboration with the child's team or their treatment team and the licensing agency. So not only are you gathering it, but you want to make sure you're reviewing that as well. And these requirements are listed out in the rate setting policy, and they are in Chapter 56 under 5622 if you're just wondering where those would be cited at for your reference. All right, so children are used to be included in the completion of the CANS. So the department strongly encourages including children or youth when it is appropriate. The more you can include children in their planning, the more effective it's going to be for that plan. This is also a very concrete way to celebrate success with children. You can use it as a motivator for children in their treatment planning, especially with older youth and with their parents. The first webinar that we did, which was back in October, we did go through some different videos looking at engagement and teaming, and the videos did show examples of completing the CANS with the youth, so that would be a really great place to go back if you want to see what that exactly would look like. You could go back to that webinar and look at or watch those videos, and that would give you some kind of a good reference point. All right, and then there's some additional resources that are out there in the CANS. There is quite a few resources that are out on the web, both on DCF's website and the PDS website. I have them listed here on the screen and with links, so you can click on those and you can get to them. We have different algorithms for the level of need for supplemental points, foster care, as well as adoption assistance. There's information on the mental health screen and then the supplemental rates. And then looking at resources, there's the online training and recertification, which Allison talked about. That is on the PDS website. There's the level of care page on the DCF website, the CANS brochure for professionals and for families. I did talk about the one for families briefly, but there's the links for them. The CANS frequently asked question page. Let's see, we have also the rate setting policy. I mean, we have quite a few resources. Again, they're both on the DCF website and on PDS online, and they're repetitive a little bit. Some of them we have on both, so you'll see some of the same ones, but there are links there for those.
Just to qualify, the resources are not in PDS online. They're on the CANS training page of the PDS website.
Thanks. Thank you. All right, we will go ahead and do some question and answers if anybody has those mode.
The question was, can you please clarify the effective date for CANS with rate review? Can rate be backdated before CANS effective date? The answer is yes. So if you do you put your CANS effective date, so when the child is placed in a foster home, let's give dates, let's talk actual dates here. So if they're placed March 1st, and you complete the CANs March 17th. Your CANs effective date will be March 17th. Because that is done within the 30-day window, when your rate setter goes to complete your rate setting, they will be able to pull in the supplemental amount for the full first 30 days. They won't have to do one pre-CANs rate and then a CANs rate. The CANs will allow them to pull all of that back to the data placement as long as it's done timely. Then for your next rate setting, this is why you can't try to sync up your timeline. And for your next rate setting, it will be due 6 months from March 17th. I can't figure that out on the fly. SACWIS will tell you when it's due. It may or may not be September 17th. It's exactly 6 calendar months.
Okay.
So it will give you the tickler for that, or you'll get an email notification. And then for the CANs, you'll have that due the same day because it's 6 months. Now, when you do the CANs, your second one, and your subsequent rate setting, as long as the child doesn't move, right? As long as the child's with the same provider, you have to work with the staff who are doing your CANs to make sure that the rate setter has time to do everything that they need to do, because now those dates are sunk up at the same date, March 17th. Your CANs will be the 17th, and rate setting, depending on when you did it, but it's usually within 30 days. If you want that to pull in, then it will sync it up.
All right. Got a couple.
But there should be communication between the rate setter and staff doing that, and rate setter should let people know how many days, and your agencies are supposed to have some policies around this, how many days, your rate setter needs to get the information to do a rate setting.
Okay, next question. How do you handle when a CANs is done both with and without you, and there is a disagreement on the rating? How should that be handled, and if adjusted, can it be backdated?
So when you say the CANs is done with and without you, are you the staff person who's rating it, or are you a provider? I need clarification before I can answer that one.
She's the TFC supervisor.
TFC supervisor. So the child's team is supposed to be a part of that. You should have discussions with people that you are being contracted with to provide treatment foster care services about how your agency staff will be involved in scoring the CANs. So you most likely are not the person that is the scoring entity. You are probably someone they're gathering information from. Now, if there's a disagreement about a score, it's still ultimately the case manager who has placement and care responsibility to land on a score for it. There is a process in foster care rate setting that if you disagree with a particular rate that's being paid, or if a foster parent is disagreeing about that, they can try to remedy that. That would go first to the rate setter in the county, and then the director of that county, and then it could go to DHA for a hearing. Obviously it's a team approach. It needs to be a team approach, and if you're having particular concerns with a specific entity or or a particular worker, that's something you should first discuss with that worker and their supervisor. And the reality is you may not always agree on scores. Ultimately, it's the person who has the placement and care responsibility to land on a score. And within the context of completing CANs as a child's team, those are things that if you do disagree, there should be some process as a team that you're going to agree to disagree on some things and then come back to those items once you maybe learn more information. So let's say 6 months, Allison and I are on a team. Allison thinks the kid is a 3 on something. I don't know. So let's say she thinks the child's a 3 on behavior at school, and I think the child's a 0. That's something we need to come a little bit closer to on. let's say she thinks the child's a 3, I think the kid's a 2. You go, ultimately it's going to be the person with placement and care who's going to be the one making the decision. But as a team, we should make an agreement to come back to that item the next time we review it, so that we can maybe come to a better agreement about that particular item. But there is likely, because people are coming from different places with the cans, there is likely for disagreement on particular items. And actually that's where teams should focus on their attention, because if you don't agree on what the intervention is or what the level of action that you need to take as a group on a particular need for a child, then how do you agree on what services you're putting in place and what intervention needs to happen? Those are critical points for you to have a discussion as a team. I don't know if anyone else wants to chime in there at all.
Mm-hmm.
Do you want to say something?
All right, our next question. It is my understanding that some of the items on the cans are eliminated on post-TPR cases. How come? How can collaboration with the adoption social worker and CHIP's ongoing social worker occur?
Mm-hmm.
Oh, I missed the word occur the first time.
Yep. So it's not post-TPR. It's when an adoption assistance agreement or a subsidized guardianship agreement are entered into, certain items go away. So the items that go away on the cans, and I don't know them off the top of my head, but if you look at a CANS desk guide, they're in there. The reason that some of the items go away is that they relate to the child and their family, of their birth family or their family of origin, and who, in terms of what that relationship is and building that relationship, which is not necessarily something that's happening once a child is adopted. The other items that are removed under smaller children, so the 0 to 5 version, some of the things that are removed relate to the actual pregnancy and delivery of the child, because there was a federal ruling some years ago that those things could not be included. So those are why those are off.
All right. Are all CST coordinators supposed to have access to WSAQUIS?
No. Access to EWSAQUIS. So some CSTs are in the county or the tribe, and they do have direct access. Those would be the ones who would have it. If you're a CST that contracts with the county, but you're not county staff, you probably don't have access to SAQUIS. But CST people are in the room, so I'll let them in.
So CSTs report their CANS information on PPS as opposed to WSAQUIS.
But if the child is dually served, if the child is also in the child welfare system, the case manager for the child will be required to put it in SAQUIS as well. So there could be dual entry there for those cases. Okay. Well, not hearing anything, I guess that's it for this one. Next webcast is
March 31st.
March 31st on
Notifications.
the website. So how and what time frame and stuff?
Yeah. All right, thank you, everybody.
Thank you.